1 in 10 people worldwide has some form of kidney disease, yet most don't even know it. Kidney disease often shows no obvious signs until it's too late, which is why it's called a silent killer. But did you know that an unusual sign like a metallic taste in your mouth could be a cry for help from your kidneys? Or that constant itching might be more than just dry skin? Your kidneys play a huge role in keeping your body balanced, from removing waste to controlling blood pressure. But when they're struggling, they send out signals, sometimes in very strange ways. In today's video, we're breaking down 8 surprising signs that your kidneys might need help. Some of these signs may seem random or unrelated, but they can be the first warning signs of something serious. If you catch these early enough, you can make a big difference in your kidney health. If you're curious about these unusual symptoms, stick around and hit that subscribe button so you never miss important health insights. Let's dive in and uncover these strange signs that could mean your kidneys are calling for help. Metallic taste in your mouth. One of the earliest and often most surprising signs of kidney trouble is a metallic taste in your mouth. When kidneys don't filter waste out of the bloodstream properly, toxins start to build up, including a substance called urea. This buildup can cause a taste disturbance, making food seem off or even unpleasant. The result? A strange metallic taste or even an ammonia-like odor in your mouth. This isn't just an odd taste that comes and goes. For many people, it can turn enjoyable foods into something hard to eat. Some individuals may find that they lose interest in certain foods altogether, especially meat, because it tastes strange or bitter. This can eventually lead to a loss of appetite and unintentional weight loss. Studies show that people with chronic kidney disease often report taste changes, with metallic being one of the most common descriptions. If you notice this unusual symptom lasting more than a few days, it might be worth looking into. Don't dismiss a metallic taste as something harmless. It could be one of the first signals your kidneys are sending that something isn't right. Addressing it early can help prevent further complications down the line. Constant itching. Constant itching is another unusual sign that could indicate kidney problems. Healthy kidneys filter out waste and extra minerals from the bloodstream, but when they start to struggle, these waste products build up. One of these minerals, phosphorus, can accumulate in the blood if the kidneys aren't doing their job, and it often leads to dry, itchy skin. This itching isn't like the mild discomfort from dry air or seasonal changes. It's often more intense, widespread, and unrelenting, sometimes affecting large areas of the body. People with kidney issues often describe the itching as deep and persistent, making it hard to ignore and sometimes even disrupting sleep or daily activities. Creams and lotions might offer temporary relief, but the itching tends to return quickly. Studies on kidney patients reveal that this type of itching, also known as uremic pruritus, is particularly common among those with chronic kidney disease. If you notice intense, unexplained itching that doesn't respond to normal remedies, it could be your body's way of signaling a buildup of toxins due to kidney issues. Seeking medical advice early can help manage symptoms and protect your kidneys from further harm. Ammonia-like breath. An ammonia-like smell on your breath can be a surprising sign that your kidneys are struggling. When kidneys function normally, they remove waste from the blood, including urea, which is a byproduct of protein breakdown. However, if the kidneys aren't filtering properly, urea builds up in the bloodstream. This excess urea can then be broken down in the mouth, producing an unpleasant ammonia-like odor. This smell is often described as strong and somewhat chemical, like the scent of ammonia or cleaning products. It's more than just bad breath from food or a dry mouth. It's persistent and often noticeable even shortly after brushing your teeth. Some people might also notice a similar taste, which can make eating less enjoyable and lead to a reduced appetite. Studies have shown that people with chronic kidney disease commonly experience changes in breath and taste due to urea buildup. This is known as uremic fetor, a distinct sign that waste is not being effectively filtered by the kidneys. If you or someone close to you notices this unusual breath odor, it's a good idea to seek medical advice. Catching kidney issues early can help slow down further damage and manage symptoms more effectively. Puffy eyes. Waking up with puffy or swollen eyes can be more than just a sign of a bad night's sleep. It could be an early indicator of kidney trouble. One of the key functions of the kidneys is to filter proteins and other essential substances, keeping them in the bloodstream where they belong. But when the kidneys are damaged, these proteins, particularly albumin, can start leaking into the urine instead of staying in the blood. This protein leakage can cause fluid imbalances that lead to puffiness, especially around the eyes. The swelling around the eyes often appears in the morning and may reduce over the day, but it can become more persistent as kidney function worsens. This type of puffiness is usually different from regular under-eye bags. It's often more pronounced and can be a sign that protein levels in the blood are low due to kidney dysfunction. Studies have shown that early-stage kidney disease can lead to proteinuria, protein in urine, which is linked to symptoms like puffy eyes. If you notice persistent puffiness that doesn't go away with rest or lifestyle changes, consider speaking to a healthcare provider. It's a small sign that could help detect kidney issues early, allowing for better management and prevention of further damage. Muscle cramps. Frequent muscle cramps, especially in the legs, can be another subtle but significant sign of kidney issues. The kidneys play a crucial role in balancing essential minerals and electrolytes like calcium, potassium, and magnesium. When kidneys aren't working properly, these minerals can become imbalanced, leading to muscle cramps and spasms. Cramps due to kidney problems tend to be sudden and may occur even without physical exertion, often striking at night and interrupting sleep. For some, the pain is sharp and intense, affecting the calf, feet, or other parts of the leg, and it can be challenging to find relief. This can be frustrating and may affect daily activities, as persistent muscle pain and discomfort take a toll on overall well-being. Studies have found that electrolyte imbalances, particularly low calcium or high phosphorus levels, are common in people with kidney disease and can contribute to muscle cramping. If you notice frequent, unexplained cramps, it might be worth having your kidney function checked. Electrolyte imbalance can be an early sign of kidney dysfunction, and addressing it promptly can help reduce symptoms and slow down any potential kidney damage. Don't ignore ongoing cramps, as they could be a sign that your kidneys need attention. Shortness of breath. Experiencing shortness of breath might not immediately make you think of kidney problems, but it's a possible sign that your kidneys are struggling. When kidneys aren't functioning properly, they can't filter waste efficiently, leading to an accumulation of fluid in the body, including around the lungs. This extra fluid can make it difficult to breathe, especially during physical activity or while lying down. Additionally, damaged kidneys can lead to anemia, a condition where the body has fewer red blood cells. Since red blood cells carry oxygen, having fewer of them can make you feel breathless even with mild exertion. This combination of fluid buildup and anemia can result in persistent shortness of breath, which can interfere with daily activities and decrease quality of life. Studies have shown that shortness of breath is a common complaint among people with chronic kidney disease, particularly those with advanced stages. If you notice frequent breathlessness, especially if it's paired with other symptoms like swelling or fatigue, it may be worth consulting a doctor. Shortness of breath isn't just a lung or heart issue. It could be a sign that your kidneys are calling for help. Early intervention can help manage symptoms and protect kidney health. High blood pressure is both a cause and a symptom of kidney problems. Your kidneys play a key role in regulating blood pressure by balancing sodium and fluid levels in the body. When they're not working well, fluid and waste buildup can cause blood vessels to tighten, leading to elevated blood pressure. High blood pressure is one of the leading causes of kidney damage and, over time, can create a dangerous cycle that further harms the kidneys. This condition, known as hypertension, often develops without noticeable symptoms, which is why it's sometimes called the silent killer. If you already have high blood pressure, it's crucial to monitor it closely as it can worsen kidney function. Many people with kidney disease develop hypertension, and studies show that poorly controlled blood pressure can lead to a faster progression of kidney damage. If you notice signs of high blood pressure, such as headaches, blurred vision, or shortness of breath, it's important to get checked out. Regularly monitoring your blood pressure can help catch early signs of kidney stress. Keeping blood pressure in check is one of the best ways to protect kidney health and prevent further complications. So don't overlook this critical signal. Foamy urine. Seeing foam or bubbles in your urine might seem harmless, but it can be an early warning sign of kidney issues. Healthy kidneys typically filter out waste while retaining essential proteins and nutrients in the blood. When the kidneys are damaged, however, they can start leaking protein into the urine. This condition, known as proteinuria, often creates a foamy or bubbly appearance in the toilet, similar to the bubbles you'd see when scrambling eggs. This foaminess is caused by excess protein, particularly albumin, which should ideally stay in your bloodstream. While some foam in urine is normal, especially if you urinate quickly, persistent foamy urine could signal that your kidneys are not filtering properly. This symptom often goes unnoticed, as many people don't look closely at their urine, but it can be an important early sign of kidney disease. Research shows that proteinuria is a common finding in people with chronic kidney disease and is one of the key indicators doctors look for in diagnosing kidney issues. If you consistently notice foamy urine, it's worth mentioning to your healthcare provider. Catching proteinuria early can help slow down kidney damage and improve long-term kidney health, making it essential to pay attention to this small but significant detail. How to take care of your kidneys. Taking care of your kidneys is essential for your overall health. To keep your kidneys in good shape, focus on staying hydrated by drinking plenty of water each day. This helps your kidneys flush out toxins efficiently. Eating a balanced diet that's low in salt, processed foods, and sugars is also important. High blood pressure and diabetes are major risk factors for kidney disease, so maintaining a healthy weight and monitoring blood pressure and blood sugar levels can significantly reduce your risk. Regular exercise helps support healthy blood flow, which is beneficial for your kidneys. Avoid smoking and limit alcohol intake, as both can strain the kidneys over time. It's also wise to be cautious with over-the-counter medications, like painkillers, which can cause kidney damage if used too frequently. Finally, schedule regular checkups to monitor kidney health, especially if you have a family history of kidney issues. Your kidneys play an essential role in keeping your body balanced and healthy, but they're often silent when they're in trouble. These unusual signs, like metallic taste, constant itching, puffy eyes, and foamy urine, can be early warnings that your kidneys need help. Recognizing these symptoms and addressing them promptly can make a big difference in catching potential kidney issues before they become serious. Taking simple steps, like staying hydrated, eating a balanced diet, and monitoring blood pressure can go a long way in supporting your kidney health. If you notice any of these signs, don't ignore them. Consult a healthcare provider to understand what's going on and to take proactive steps. If this video helped you learn more about kidney health, please give it a thumbs up and don't forget to subscribe for more tips on taking care of your body. Don't forget to check out the other related videos on the channel.